I'm of course here today as your governor, but I want you to know I'm also here today as a father of 4. And I think about these healthcare issues, particularly when it comes to children and families, through that prism. What would I want as a father for my children? And then how do I make sure I deliver that for all children across Pennsylvania, the nearly 2 million children in our Commonwealth? Lori and I want for them the absolute best medical care with accurate information, the best medicines and treatments and vaccines that they can have so they can live healthy lives. And as parents, we want the freedom to make decisions for our children in their best interests in consultation with medical experts. We don't want politicians who don't know best taking away our freedom to be able to be parents over our children and interrupt or interfere with the relationship with our doctors. I believe the same thing is true about vaccines. I want the freedom to be able to provide my children and to be able to take myself the vaccines that I think are necessary to keep me and my family safe. I think we need to have clear and accurate information and fact-based recommendations coming from doctors in Pennsylvania. And I believe all Pennsylvanians should have access to the vaccines that they want for themselves and their children, and then the freedom to be able to make decisions that are best for you, especially here in Pennsylvania, especially here in Philadelphia, just a few blocks from where this grand experiment in freedom began. This is the birthplace of freedom, and I think medical and healthcare freedom is central to those tenets of what we need more of in this country. I want trained professionals who know science to be empowered to guide you. I do not want you to be guided by someone like RFK Jr., who I believe is wholly unqualified to give medical advice and who is restricting our freedoms here in Pennsylvania and across this country. We have seen, sadly, in recent months, the President of the United States and RFK Jr. spreading blatantly false information about vaccines and their efficacy. And they're taking real concrete steps to restrict your ability to get access to a vaccine or your ability to decide what vaccines your child should get. Let me give you just one example. RFK kicked off 17 highly qualified medical experts off of the Advisory Committee on Immunization Practices, known as ACIP. Now, everybody in this room knew what ACIP was. I don't think a whole lot of people knew what ACIP was before RFK Jr. blew it up, including the very competent, the very qualified Charlotte Moser, the co-director of the Vaccine Education Center right here at CHOP. He then replaced those individuals. You can clap for Charlotte, that's okay. And then he replaced qualified people like Charlotte with a whole bunch of vaccine skeptics who willfully ignore science and embrace conspiracy theories. That's dangerous for healthcare. And remember, this is the group that recommends which vaccines should be used for which patients. And until recently, Pennsylvania relied on ACIP to determine how we would recommend vaccinations. That created a conflict earlier this year because after the FDA approved the new COVID vaccine only for seniors and for those with pre-existing conditions, ACIP then didn't meet for nearly a month. Major pharmacies like Walgreens and CVS, as well as the small mom-and-pop pharmacies that we're fortunate to have in our communities, well, they were left without any clear guidance, and then they felt that they couldn't offer the COVID-19 vaccine to anyone, especially those who were explicitly included in FDA approval. In response, we didn't look to Washington for answers, particularly when you've got the conspiracy theorists running that place. Instead, I directed the Pennsylvania State Board of Pharmacy to meet and expand the list of organizations that pharmacists here in our Commonwealth could rely on for guidance as to who would be eligible for the COVID vaccine. Now, as a result of our action, pharmacists in Pennsylvania can look to medical experts who actually follow science. And that includes now, as a result of our action, the American Academy of Pediatrics, the American Association of Family Physicians, or the American College of Obstetricians and Gynecologists, for their vaccine recommendations. As a result of that action, pharmacies here in Pennsylvania are now offering the COVID vaccine to people 65 and over and those with pre-existing conditions without a prescription, and anyone else can go in and get their COVID vaccine if they so choose with a prescription here in Pennsylvania. The Department of Health, led by Dr. Deb Bogan, who you'll hear from in a moment, issued clear, evidence-based vaccine guidance for other vaccines, recommending that doctors follow those same groups of medical experts I mentioned before, providing clarity in an area where Washington has tried to sow chaos. We are providing reliable, fact-based information, ensuring Pennsylvanians have full access to proven vaccines and the freedom to make the best decisions for themselves in consultation with their doctor.